Welcome back guys. Now let's continue with the topic of pressure, volume, loop. See, in the previous video we have discussed about the compliance and elastance, right? It's just the extension of the same topic. If you understood what exactly is compliance and elastance, this topic is going to be very easy, cakewalk for you. Okay? So now, tell me, how many lungs do you have? You are having 2 lungs, sir. Are we having the same lungs during inspiration and expiration? Tell me. Yeah, you are having the same lungs. You are not getting a new pair of lungs, right? You are having same lungs during inspiration and expiration. But when do you think lungs are more compliant? During inspiration, lungs are more compliant, or during expiration, lungs are more compliant? When you can stretch the lungs easily, which lungs are easily stretchable? Inspiratory lungs or expiratory lungs? I am talking about the property of the compliance. Okay? Most of the students will think, sir, during inspiration, lungs are stretching, right? So yeah, during inspiration, lungs are more stretchable, more compliant. No. Listen to the explanation first. Guys, first see, during inspiration, what is happening? Let's say, here I am showing you alveolus. Alveolus. During inspiration, what happened to the size of the alveolus? Yes sir, the size of the alveolus is increasing. The lungs are becoming big. The lungs are expanding. But the point is, see, in your lung, there is this protector molecule. Okay. What is this protector molecule? Surfactant. Okay, here surfactant is present, which is trying to decrease the surface tension. During inspiration, look. During inspiration, what is happening? Sir, as the lung is expanding, what happened to the distance between the surfactant molecules? Sir, now the distance between the surfactant molecules, same number of molecules are present, still same number of molecules are present. But what happened to the distance between the surfactant molecules? It is increasing. The surfactant molecules are moving away from each other. Now for such a big area, now relatively speaking, less amount of surfactant is there. So now tell me, during inspiration, the surfactant molecules are moving away from each other. So what happened to the surfactant concentration? Surfactant concentration decreases. Surfactant concentration decreases because surfactant molecules are moving away from each other. Now you tell me, we all know surfactant will decrease surface tension, but right now surfactant is going down. So what will happen to the surface tension forces? Surface tension will increase. So during the time of inspiration, our surface tension forces in the lung gradually increases. Tell me, whenever the surface tension is increasing, what will happen? Sir, according to our formula, whenever surface tension increase, compliance should go down. So right, what will happen to the compliance property? The compliance will decrease. Compliance will decrease. Okay. So finally, I am saying you, during inspiration, what happens usually? So students will think during inspiration, lungs are expanding, so there will be more compliance. But no. During inspiration, the compliance is actually decreasing because the surface tension forces increases. Okay, because the surfactant concentration relatively decreases. Okay. Next, exactly opposite. What happens during expiration? During expiration, sir, very simple. The alveolus is undergoing collapse. Okay. The alveolus is undergoing collapse. So what happens to the distance between the surfactant molecules? Now all the surfactant molecules, now they are coming together. The surfactant molecules are coming together. So can I say, for such a small area, now there is more surfactant. Okay, relatively speaking, the number of molecules are still same, but the surfactant molecules are coming close together, so the concentration increases. So right, during expiration, the surfactant concentration will be increased. What happened to the surface tension now? Whenever there is more surfactant available, the surface tension forces decreases. Surface tension decrease. Whenever surface tension decreases, what will happen to the compliance? Surface tension decreases, the collapsing force decreases, so compliance will be more. So compliance will be more. Compliance will increase. So now you understand. So you are having the same pair of lungs, same set of lungs. During inspiration, expiration, you are having the same lungs, but their nature changes. During inspiration they are less compliant, and during expiration they are more compliant. The compliance nature changes. See, it's just like you are having a girlfriend. Do you think always she is going to behave in the same way with you? No, her behavior changes, right? Her nature changes according to the situation. Okay, in certain time she is going to be very much romantic with you, and certain time she is going to be more aggressive with you. So in the same way, you are having a same lung, but its nature changes, its behavior changes. During inspiration, they are going to be less compliant, and during expiration, they are going to be more compliant. Why? Because of the change in surfactant and surface tension forces. Because of the change in the surfactant, surface tension will change. Whenever the surface tension is changing, automatically compliance will change. So, okay. So, this is the reason. Look at here in this diagram, the pressure volume loop. See in this pressure volume loop, on x-axis, see whenever you are seeing a graph, always look on the x-axis. What is given on the x-axis? We are talking about the pressure. Okay. On the y-axis, what we are talking about? Volume changes. So, here I am talking about the volume change. Here I am talking about the pressure change. Okay. Volume change, pressure change. So, can I write something like this? Delta V by delta P. Delta V by delta P, volume change by pressure change. So, tell me, delta V by delta P, what it is? It's a compliance. So, these are the compliance curves. This flow volume loop is nothing but the compliance of the lungs. So, right here we are, what we are checking? We are checking the compliance curves of lung. These are the compliance curves of the lung. How many curves I am showing you? Not showing one curve. Here I am showing two curves. Okay. The basic mathematics. What is the basic mathematics telling you? Teaches you. The higher the curves, higher values. The lower the curves, lower values. Okay. Always when the curve is higher, it is having higher value. When the curve is lower, it's having lower value. Simple logic. See here, I am talking about the compliance of lung during inspiration, expiration. Inspiration, expiration, we all know. During inspiration, see, this is the compliance of the lung. Okay, this is the compliance of the lung. And during expiration, here is the compliance of the lung. Okay, the compliance of the lung during inspiration and expiration. Are they same? The compliance of the lung during inspiration and expiration, is it same? No, definitely not. The compliance value is different. I have told you during expiration, the higher compliance, and during inspiration, the compliance is less. That's why the expiratory compliance is more when compared to the inspiratory compliance. So, the higher the curve, higher compliance, the lower the curve, lower compliance. Okay, or you can say the higher the slope, higher compliance, the lower the slope, lower compliance. Simple. So, always from this, we can say we are having the same pair of lungs here, but the compliance of the lungs will be different during inspiration and expiration. Okay, let me prove it here itself. What is compliance? Compliance means for a given pressure, how much volume changed? For a given pressure change, how much volume changed? Look at here. At any given pressure, let's say here I am talking about minus 5 centimeter of water pressure. Let's say minus 5 centimeter of water intrapleural pressure. See, where do you see more volume change? Sir, expiratory lungs are having more volume when compared to the lungs during inspiration. Okay, lungs during inspiration. Now, this itself proves, sir, at any given pressure, tell me, where do you see more volume in the lungs? Expiration. Expiratory lungs are having more volume when compared to the inspiration. Okay, why such changes are happening? Tell me. See, there is a difference in the compliance, right? Let's say here, this is the difference. This is the difference. Okay, this is the volume during expiration, and here is the volume during inspiration. So, there is a difference, right? At the same pressure, there is a difference. So, this difference is called as, what? Hysteresis. This difference is called as what? Hysteresis. Now, why there is this hysteresis? Why this difference is coming? Why there is this difference? This hysteresis is due to, we all know why there is difference in this compliance during inspiration, expiration, why the lung compliance is changing. Okay, why there is this difference in the compliance? The difference at hysteresis is due to change in, okay, surfactant and surface tension. So, we all know the surfactant concentration is changing and surface tension forces are changing. Because of the change in the surfactant concentration and surface tension, the lung compliance automatically changes. Because we know our lung compliance is dependent on what? Our lung compliance is dependent on the surface tension. Whenever surface tension increases, decreases, compliance also can increase and decrease. Simple. Okay. So, with this, what we have completed? We have completed the flow volume loop. So, what is the final summary? The final summary is lungs are always more compliant during expiration than inspiration. Okay. Now, with this, now let's see a few more curves which might come up in your exam. Let's say here in this condition, this is my average compliance, guys. Okay. Here is my average compliance. Let's say that there is a healthy compliance of my lung. Okay. Average compliance of my lung. When compared to my healthy lungs, okay, when compared to the healthy compliance or normal compliance, here I am showing you the compliance of my patient lungs. This is the compliance of my patient lung during inspiration, and here is the compliance of my patient's lung during expiration. So, tell me, when compared to my compliance, what happened to the compliance of this patient lungs? The higher the curves, higher values. So, here there is increased compliance. So here there is increased compliance, sir, because the higher the curves, higher values. When compared to my compliance, this patient lung compliance is more. Now tell me, in which condition do you think the lung compliance increases? Which lungs are more compliant? Have I already taught you previously? Sir, which lungs are more compliant? Emphysematous lungs. Look here, emphysematous lungs are more compliant and fibrotic lungs are less compliant. So right here, this patient is suffering with which condition? Emphysema. Okay, emphysema, they will use the word COPD, chronic obstructive pulmonary disease, example emphysema. Now in the same way, when compared to say this normal compliance, here is a normal compliance, no? When compared to the normal compliance, this patient lungs are less compliant. Okay, here there is less compliance. Now which lungs, tell me, which patient do you think the lung compliance is less? See, compliance is decreasing. Which condition? Compliance is going to be less. The answer is pulmonary. Okay, pulmonary fibrosis. Okay, pulmonary fibrosis. Also, ARDS, respiratory distress syndrome. Have I taught you in a patient who is suffering with a neonatal respiratory distress syndrome? Here, look guys, in a preterm child where there is a surfactant deficiency, the child is going to suffer with which condition? Neonatal respiratory distress syndrome. In a person who is suffering with the neonatal respiratory distress syndrome, what will happen to the compliance? The compliance is going to be less because surfactant is not there. Without no surfactant means no compliance. More surfactant means more compliance. Just simple logic. Okay. So yes, in which condition compliance will go down? Pulmonary fibrosis and ARDS. True. Next, look at this curve. This is little tricky. First of all, this is the compliance of the lung during inspiration, expiration. Okay, this is normal. Let's say here is normal. This is the normal compliance. When compared to the normal compliance, what happened to these lungs? See, these lungs, there is more slope. Definitely there is more slope. Okay, sir, here there is more compliance, no doubt. But what is the difference? See, in a normal healthy lungs, there is hysteresis seen. There is this difference. The difference in the compliance during inspiration, expiration, that there is hysteresis. But what about the hysteresis here? There is less hysteresis, or you can say there is almost no hysteresis. So here, the word that I am writing here, there is no hysteresis. Okay, no hysteresis or very minimal hysteresis is seen. So tell me, what are these lungs? Here there is more compliant lungs. These lungs are more compliant, and that too the hysteresis is not there. The difference is not that much. What are these lungs? Sir, have I taught you? Hysteresis is due to what? Hysteresis is due to surface tension. Previously, I have told you. What is the reason for this hysteresis? The reason for this hysteresis is due to surface tension changes. Whenever surface tension is changing, the compliance also changes. That will bring the hysteresis difference. So now here hysteresis is not there, which means surface tension is not changing. Surface tension is not there. No surface tension changes, no hysteresis. So tell me, in which lungs surface tension is not there? In which lungs there is no concept of surface tension? There is no surface tension. Have I taught you previously? Saline filled lungs. Sir, in saline filled lungs, there is no surface tension. Without surface tension, how can it change? So there is no surface tension changes. Like surface tension is not increasing, not decreasing during inspiration, expiration. So, sir, in saline filled lungs, there is no surface tension. Without surface tension, there is no concept of hysteresis. Okay. So, write these lungs, okay, which I am showing here. These are saline filled lungs. Saline filled lungs. These are saline filled lungs. Have I previously taught you? Saline filled lungs are more compliant. Without any doubt, see, saline filled lungs are more compliant. But they are not having the hysteresis. Here, that's the same thing I am showing. Sir, saline filled lungs, yes, they are more compliant. They are more compliant. But there is no surface tension changes. No surface tension changes means no concept of hysteresis. No difference. The compliance is not going to change. Okay, not much. Chalo. Next, the final graph in this topic is, see, look at this question. Sir, you are having three people, three subjects like ABC, 3 persons are there, and 3 compliance curves. Okay, A person compliant curve, B person, C person lung compliance curves. We are having 3 compliance curves, ABC. Are the subjects. One of the subject is normal, other is suffering with emphysema, and the third person is suffering with pulmonary fibrosis. See, the third person, what he is taking drugs like amiodarone bleomycin. The person who is taking drugs like amiodarone bleomycin, they will develop pulmonary fibrosis. They will develop which condition, guys? Pulmonary fibrosis. Now tell me, which person is considered as a normal, who is having emphysema, who is having pulmonary fibrosis? First of all, my dear students, always look on the x-axis and y-axis. On x-axis, I am talking about the volume change. On x-axis, I am talking about the pressure change. On y-axis, volume change, delta V by delta P. Volume change by pressure change. Okay, so these are compliance curves. A, B, C are the compliance curves. The higher the curve, higher compliance. The lower the curve, lower compliance. So tell me which curve is higher? A. And which curve is lower? C. So right, sir, the B person, let's consider him as a normal. Okay, let's consider him as a normal. Okay. Now when compared to this normal person, this A person is having higher compliance. So tell me which diseases the lungs will be having higher compliance? Emphysema. So A person is suffering with emphysema, and when compared to B, the C compliance is going to be less. Which condition, guys? Pulmonary fibrosis. Okay, pulmonary fibrosis. Who will develop pulmonary fibrosis? The person who is using drugs like amiodarone, bleomycin, busulfan, carmustine, cyclophosphamide, methotrexate. So these are the drugs. Okay, again I am repeating: amiodarone, bleomycin, busulfan, carmustine, cyclophosphamide, methotrexate. These are all the drugs which can lead to pulmonary fibrosis. So pulmonary fibrosis means less compliance, emphysema means more compliance. Okay, so this is how the questions are going to show up in your exam. Very, very important topic. Okay, the pressure volume loop. So if you want to understand the pressure volume loop, you should have a better understanding of what exactly is compliance and elastance, and how this compliance is dependent on surface tension and surfactant. Okay, so I am going step by step, point by point. If you follow the order, the topic will be easy for you, cakewalk. Okay, with this I have completed the topic of the pressure volume loop. Hope the video is helpful. See you in the next video. Thank you.